pleasure. Dr. Smith, it's all yours.
Thank you, Chancellor Gold. As Chancellor Gold mentioned, the Nebraska Biocontainment Unit is preparing to accept, at the request of the Department of State, an individual with Ebola who was on a mission in Africa and acquired this very serious viral disease. This is not about a single institution. This is about collaboration and about partnerships. Dr. Joseph Cerno, Chief Medical Officer for the State Nebraska Department of Health, is very much a partner in this. If it weren't for the State Department of Health, we wouldn't have a unit. We collaborated with the building of it in 2005. We collaborated since then, and jointly it was opened by the two of us when we were visited by the State Department. Also, I'd like to acknowledge Dr. Adi Poor of the Health Department, Douglas County Health Department. We feel that the university, the Nebraska Medical Center, which is the hospital, and public health are partners very much in taking on an obligation of this sort. The biocontainment unit is built for this sort of events. It was inspired by the SARS outbreak of 2003, where a number of healthcare providers became very ill and some of them died, in Canada in particular. And since that time, there have been a number of illnesses like avian flu and monkeypox that have posed a potential threat. The idea was that we could give this person first-class care in an environment that provides for optimal safety. So we have a special unit with special airflow and pass-through autoclaves and a number of mechanical features, but our most important feature really is our staff. We have a very specifically trained staff of 30 to 35 people. We actually have had a number of individuals volunteer to join our staff since Ebola became an epidemic agent in Africa. And our group inspires me. Working with them on a daily basis is remarkable. And they're one of the main reasons why we feel we're able to provide care in a safe environment. So I'd ask my co-director, Angela Hewlett, to talk a little bit about Ebola virus and the treatment or lack thereof.
So as you know, there's an ongoing outbreak of Ebola virus in Africa. Several countries in Africa have been affected. So far, we have had 2 individuals being treated in the United States that were highly publicized and taken to Emory University. This will be the 3rd individual that will come to the United States for treatment. The virus itself is a scary virus, but I do want to emphasize that this is a virus that is transmitted by direct contact, so contact with infected secretions, blood, bodily fluids, that sort of thing. This, unlike SARS, avian influenza, and other viruses of that nature, is not an airborne virus. Our personal protective equipment in the Nebraska Biocontainment Unit is geared for this virus, as it would be for SARS or avian influenza as well. The outbreak itself is escalating in Africa. As you know, it has affected several countries now. And this is of concern. We have a lot of people over in Africa, physicians who have gone over to volunteer to take care of patients over there. And because of that, there was a high likelihood that one of these people or several would become infected. Again, the virus itself, there were some investigational products being used that you may be familiar with. One is the ZMapp product, which is a monoclonal antibody that was given to the 2 individuals who arrived at Emory University. This product is no longer available. There is none of this left to use. However, there are some additional products that we are looking into. But the tough nature of this disease is just the fact that there isn't any notable therapy other than good supportive care, which we're prepared to provide at the Nebraska Medical Center.
Thank you. I'd like to ask Mark Rupp, epidemiologist at the Medical Center, to make a few comments.
Thank you, Dr. Smith. I serve as the medical director of our Department of Infection Control at the Nebraska Medical Center, and I am very confident that we can care for this patient safely. As Dr. Smith related, this is a specially designed unit. It's locked, it's secured, it's separated physically. It has negative air pressure, HEPA filtration of the air. It's not recirculated air. There's an autoclave on the unit, so all medical waste materials will be autoclaved before they're removed from the unit. The team that's led by Dr. Smith has drilled for this for years. They are well prepared, and I'm very confident that we'll care for this patient appropriately. I think there will be a number of folks who will ask, why are we bringing somebody here to the United States, to the Nebraska Medical Center? with Ebola virus infection. And then my answer to them would be, this is part of our mission. Obviously, these healthcare providers were on a mission in Africa, and our mission is to care for patients. And we're going to do that, and we're going to do that safely and as effectively as possible. In addition, as an academic medical center, part of our mission is to push back the boundaries of our knowledge, and we're going to try to do that as well. We will be looking at these agents, as Dr. Hewlett has mentioned, and we'll be learning as much as we can in order to help patients in the future. Thank you.